Good afternoon, everyone, and welcome to the 3 o'clock session. My name is Tina Costa, and I am one of the directors with the PHSA Office of Virtual Health. Continue to be your host for these virtual sessions. And again, my pleasure to welcome or re-welcome you back to the 2023 BC Digital Health Forum, inspired by Canada Health InfoWays Digital Health Week. For those of you just joining us this afternoon or for this particular presentation, want to encourage you to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of the BC First Nations. May we all take pause together to honor their connection to this land, to their stewardship in caring for and nurturing these lands for all time. And also let us give thanks for the opportunity today to gather, to learn, to collaborate, and to provide care on these beautiful lands. I now have the pleasure of introducing our next presenter. I'm introducing Zachy as Zachy O because I've just tried to pronounce his last name and it didn't quite go as we had hoped. So I have promised him I will learn how to do it at one point. Zachy is the Executive Director of Digital Health Strategic Initiatives with the BC Ministry of Health. In the health sector IMIT division, he leads the delivery of the Improved Provider Experience strategic objective of the digital health strategy. He's a digital transformation leader with public and private sector experience, including past executive roles as head of information technology and chief information officer. Zachy is passionate about leveraging technology to drive strategic outcomes and has led large-scale provincial transformational initiatives since joining the Ministry of Health in 2008. Please join me in welcoming Zachy for a talk on connecting patients and providers through the BC Provincial Attachment System, also known as PAS. Zachy, it's all yours.
Thank you so very much, Tina, for the introduction, and really pleased to be here with you all this afternoon and to talk about something that is of interest to all of us. You probably have heard or seen the social media campaign around everyone deserves a family doctor. Yes, we recognize that, and the province of BC does acknowledge that fact as well. And so I'm going to take you through this presentation. First of all, looking at the strategic context. And then from the people's side of things, who's really seeking to get attached to a primary care provider and who's attaching new patients in the province? We'll look at then the platform that we have built and deployed to help facilitate attachment between a patient and providers. And we'll walk through at a very high level because of our time. How does attachment really happen? Who are those involved from the patient experience perspective and the provider experience? We'll look at the early data that we've seen since the launch of this platform since July the 1st. And so stepping back to look at the strategic context, like I mentioned, it's an important issue, a complex one at that touches everyone because we all do need care when it comes to our health. And so attachment to primary care provider has been a long-standing complex issue throughout BC. And so given that recognition, the Ministry of Health undertook an exercise to refresh its primary care strategy. And within this primary care strategy, a number of objectives were identified. 1, to empower patients, 2, to increase attachment, 3, to enhance access, 4, to facilitate model of longitudinal team-based care, and also to support integration and continuity of care. And so looking at this strategy overall, it also includes, as you would imagine for any modern day strategy, a digital component to it. So the capability as well as the solution to improve attachment to culturally safe team-based longitudinal primary care for people in BC who want to be attached to their provider. And as you're probably aware, we've launched way back the Provincial Digital Health Strategy that would enable a number of program area strategies, such as the primary care strategy. And within our digital health strategy, we have 4 key objectives. Number 1, to empower patients. Number 2, to improve provider experience. Number 3, to establish connected health system. And number 4, to enable enterprise system. And how are we going to do this, particularly from the primary care standpoint? What we plan to do, one, is to ensure that we maintain family practice clinics as the gateway to the rest of the health system. And also, number 2, to build a provincial attachment system to actively monitor and facilitate patient attachment across the province. And last but not the least, to also ensure that we provide the ministry with data that provides a clear understanding of primary care infrastructure across the communities to help invest, to help plan, and also to ensure that we deploy resources where necessary across the province. You'll recognize that I've used the word attachment a number of times, even right off the bat here. And so let's step back and really get to understand, what do we mean by attachment, especially from this context. Provider-patient attachment include an affiliation with a regular primary care provider that is confirmed, and the affiliation can be formal, that is contractual, or informal, just verbal agreement between the patient and the provider. And the goals of affiliation are to deliver longitudinal care and establish a therapeutic relationship, that is a relational continuity between the provider and the patient over time. And the affiliation will include patient affiliation to the team, to the clinic, or even to regular place of care. So just important for us to establish what we mean by attachment. So moving on from the strategic context, let's really ask, who are those seeking attachment? And that's the information we really need to get a good handle on in the province to help us plan. As of the last time, this information comes from Canadian Community Health Survey. The last couple of months ago, I got a survey in the mail asking me some few questions to establish whether I'm attached to a primary care provider or not. We can do better than that. And that is one of the drivers for the development of the provincial attachment system. So we have a number of demographics who are seeking to get attached to a primary care provider. One, of course, newcomers, those people who are new to town, who are new to the province, who are new to the nation, that do not have regular healthcare provider. But we also have unhappy patients, those that are dissatisfied with their provider as they are unable to provide the care they need. Nothing personal, but it might be because they need continuous care due to their complex or chronic health conditions. It might be also that they want a provider that has experience with their specific peculiar health needs, or they just want an accessible location with an option for virtual remote care. There could be a number of reasons why they are dissatisfied with the current provider they have. And this third group is those who are involuntarily detached. I happen to just fall in this category recently. I've had a primary care provider, family physician for a long time for myself and my family, but I just got to know that my family physician has retired. I wasn't told, it was a call to just book an appointment, and they said, sorry, your family physician has retired. And so this involuntarily detached group of people are those who, for some reason or the other, their provider are unable to provide care, they retired or they moved on. And so these ones are involuntarily detached. And the last group of people, because they care for people, they have people in their care, they have family members, they have people in the social circle. And so they also want to get these folks attached to family physician or even a nurse practitioner. A number of people, the last survey and the last number given by Canadian Community Health Survey indicates that 1 in every 5 British Columbians doesn't have a family physician. But we want to get a good handle on that and have that information and not just rely on surveys that might be accurate or might not be accurate. So that is the demand side of things. So how about the supply side in terms of the provider, the nurse practitioner, as well as the family physicians that are providing health? They do not want to leave their patient without a primary care for sure, but also they have needs. They want to ensure that their capacity is sufficient to be able to take on new patients. They also want to ensure that within their capacity, they're balancing between the complexity of the patient's health condition. And so with all of this, they want to ensure that they have enough time to be able to provide care to their patient rather than spending time on record keeping. And so that leads to the need for these providers to be able to work within their integrated electronic health record and be able to pull the information in and be able to also send information from that. We recognize that currently the communication and also the information is fragmented. And so how do we pull all of this together to be able to support the provider to provide the care that the patient need? So we have nurse practitioners who are attaching patient. We have family physicians as well who are attaching patient. And I must also let you understand that given the complexity of the issue, the ministry has taken a multi-pronged approach to address the issue of attachment. From the provider side of things, there was the longitudinal family practice payment model, a new payment model that has been established as part of the refreshed primary care strategy. There's new to practice incentive. There's also the stabilization fund that was put in place a year ago to cover the overhead cost of the family physicians. So with that said, how are we facilitating this attachment? How is a digital component coming in to help address some of this issue? And that's where my branch, not just my branch now, but the Ministry of Health in collaboration with PHSA, Doctors of BC, and a number of stakeholders across the health sector, we've come together, collaborated, and co-created what is now known as the Provincial Attachment System. This is an integrated platform that has 3 components. One is patient-facing, and that is the Health Connect registry, where the patient will get on the platform and indicate their interest to get attached to a family care provider, be it a nurse practitioner or family physician. And then we have the provider-facing side of the platform that has 2 components. That is the panel registry, where provider will upload the information around the patient they have in their panel. That is the patient they're caring for as the most responsible provider, as well as information around the patient complexity and things like that. But also there is the provider clinic registry, which allows us, that is us being the health sector system, the ministry, to understand the capacity within the health sector. How many clinics do we have? How many service providers are working within the clinics? What kind of services are they providing? What is their hour of operation? And this is also an avenue for them to also indicate their capacity and the ability to be able to attach new patients. So that is the provincial attachment system, and all the green check marks that you see there is to kind of give ourselves a pat on the back to say, yep, we'll launch this July 1st of this year, Canada Day present to the province. And also, we didn't stop there. We've always been working together with Doctors of BC, colleagues and stakeholders to ensure that we address their needs and continue to evolve the system. And that led to the adoption of the system on September 20th, where we have a number of providers signing on to the platform, indicating their interest to attach new patient, uploading panel, so that we can begin to build that information to help us understand the capacity within the system. So having done this, the question is, how does attachment happen? We have the patient indicating interest that they want to get attached to a provider, and then the provider also using the same platform such that they're not managing their own separate wait list. We now have a platform, provincial, across the province that would allow providers know the number of people or those that are available that are seeking to get attached, and they'll be able to pull from that list. So we'll just walk through that from the patient side. We have the Health Connect registry, and that is hosted by HealthLink BC. If you call 811, that's HealthLink BC. This will allow patients to register themselves, but not only themselves now, they have the capacity to register the family or a person within their care for attachment to a family doctor or a nurse practitioner. And the benefit of Health Connect registry is that, one, it tells the ministry who are the people that are actively seeking attachment in this province. We do not need to wait for CCHS survey to determine how many people actually have family physicians or do not have family physicians. And this will also eliminate the need for people to put themselves in multiple wait lists, and also become a single, this platform will then become a single patient list used by all longitudinal providers in all communities in BC for the purpose of connecting people to a family doctor or nurse practitioner in their community. Since I am recently involuntarily detached a patient in BC, I get to use the Health Connect registry as well to indicate my interest in seeking a family provider. So wish me luck in that. So once registered, the HealthLink BC team will support the people that are waiting to be attached by providing them with information on healthcare services. Yes, while you're waiting to get attached to a nurse practitioner or a family physician, there are other services that HealthLink BC could offer to the patient. There are other allied professionals that could support them, health information that you could find on HealthLink BC as well as health advice from 811. So that is the patient side, leveraging the Health Connect registry component of the Provincial Attachment System. On the provider side, we have the clinic provider registry. And like I indicated, this is where primary care clinics will enter the hours of operation, who's working in their clinic. And also this is linked to ensure that we have the people that are practicing, that have been confirmed by the various body in terms of the College of Physicians and Surgeons, College of Nurse Practitioners and Nurse Practitioner, ensuring that we have these people validated on the platform, the information is there. But one thing to note though, this is not an avenue to force attachment. These are providers that are trusted. They want to give care to their patients. So this is just an avenue to ensure that we all have the information, both on the provider side, on the ministry side, to be able to plan and to ensure that capacity are being managed, to ensure that across the health sector, we're effective, we're efficient in providing the care that the citizens need. And so through the rostering registry, also, all the longitudinal family physicians and nurse providers will upload their patient panel information. We now have a central repository to ensure that the ministry has a snapshot of who is really attached. And who do we have that are attached to multiple physicians for one reason or the other, such that we can free up capacity and ensure that the providers can take on new patients if we have a number of patients on multiple provider panel lists. The providers will also use the rostrum registry to inform the ministry if they are actively accepting new patients and how many patients do they have capacity to attach at the time that they're providing that information. So that's on the provider side. Since the launch of this integrated platform, we've seen some progress and some successes, and we're looking forward to more. And so this is the early data that we've received. This is as of October mid last month, where we have a little over 250,000 people that have indicated interest to get attached. We know that we need to publicize this a little bit more across the province so that people know to go to Health Connect registry to use that to indicate their interest to get attached to a family physician or a nurse practitioner. On the clinic and provider registry side, like I said, since the adoption, we have the providers uploading their information indicating their type of clinic, whether it is episodic, longitudinal, whether it is mixed, and also indicating their hours of operation, the type of clinic they have, the people that are working within those clinics, and also whether they are accepting new patients or not. And that's the table you see down here to your right. As of the date of this report, we have about 547 providers that have updated their information on the platform. Number of providers accepting new patients, around 88, and they've indicated that they have close to 10,000 spots for them to be able to accept new patients. The information is growing, and we're learning more to be able to improve the platform and ensure that this provincial attachment system is indeed a platform to connect the patient to the provider who are seeking to ensure that they have the care that they need. And so I'll pause there for now and see if there are questions, to answer questions from you. Thanks.
Thank you.
Over
Thank
to
you
you.
so much, Zachy, for sharing the work that's happening around patient attachment and your personal experience around it. It's really a topic that's close to all of our hearts for everyone in BC, as I'm sure, if not yourself, but you know someone who's also looking for a provider for you and your family. Really taps into how important it is and really how complex the problem actually is. So I appreciate the attention and resources focused here to really understand the problem from multiple perspectives. We do have a couple of questions. One that I think you may have spoke to, so I'm going to start with the other in case we run out of time. Question is it anticipated that future iterations of PAS will include automatically pushing provider panels from electronic medical records to reconcile these lists automatically on a quarterly basis? And really the impetus is around reducing that administrative burden.
Wow, that person must be a provider or an EMR vendor. You nailed it, absolutely, because one of the key objectives of the improving provider experience is to reduce administrative burden. It's not enough for us to throw tools at them. Okay, we've developed provincial attachment system, so go figure out how you continue to update your panel. Absolutely, in our roadmap is the need to integrate with the provincial attachment system, their EMR, so that they're able to manage their panel, as I indicated earlier, within their integrated electronic medical record, EMR, to be able to push the panel information to PAS, and for PAS to be able to push it back to them so that they can add or remove, because over the course of time, patients will move from one location to another, they will change cities, they will change location, they will change work, and that will really necessitate the need for the provider to keep their panel up to date. And so yes is the answer, and hopefully you don't follow up with a question around when. That is being planned. Thank you.
Thank you, Zachy. That question hasn't come up yet, so we'll end the session there. Really appreciate your time today. And just again, thank you for sharing, even at a high level, really what's coming down the pipe for us. Really exciting stuff. Thank you again. As typical, we will be putting a poll up for those of you to provide some feedback about the session that you've just joined us in. And we'll be shifting over to our next session, which is entitled, Are You Ready for It? Lessons learned in supporting virtual care education for a new remote patient monitoring service. And if you're just joining and this is your first session, just a reminder that you can navigate to the next session using the panel on your left-hand side, and we will see you all there very shortly. Thank you again, Zachy, much appreciated.
Thanks, Tina and the team. Enjoy the rest of the session. Thanks, everyone.
Thank you.